Colorado's high-definition news leader. This is 9 News.
The holidays can bring up a range of emotions, and for many of us, it can be a very difficult time of year. Kim is out in the newsroom with our volunteers from the University of Colorado's Depression Center. And Kim, instead of feeling happy and excited about the holidays, some people actually get pretty depressed.
You know, I think many of us can find ourselves in this position. You know, sometimes it's even a letdown after the holidays. Other times it's family tension and a lot of things that lead to these problems. Plus the fact, as we talk about, the sun sets so early, it's dark so early, a lot of things factor in. We're going to talk to Dr. Robert Feinstein with the University of Colorado Psychiatry, and we're talking about seasonal depression and things like this. Explain what that really is.
Well, usually during the winter months when the light goes low, people are more depressed. And that just has to do with some hormonal changes, mostly melatonin that changes in this time of year. So people feel more fatigue, they stay inside more, they have less light exposure, and that often leads to seasonal depression, especially in the shortest days of the year, which come around December 21st.
You know, and then there's just the pressure of the holidays and the season. And I think sometimes we reflect on the past year when New Year's rolls around. How do we know when maybe we need to talk to somebody?
I think holidays in particular bring in a time when expectations meet reality. People have all kinds of hopes for the holidays, and then it turns out not exactly as they imagined. And so people tend to get more depressed around holiday times. It's a time to be missing family, to thinking about finances, planning for the new year. People take inventories around holiday times, and that often can make them depressed.
If you're a family member that suspects someone is struggling within your family, what's your advice? What should we do?
Well, first and foremost, it's most important to be available and to talk to them, give them a free voice to talk about feeling sad and down and depressed and try to understand where they are. And it's especially important to inquire if they may be suicidal. Suicide is a big problem, very common in people who are depressed, and about 30 to 50% of people who have depression never actually ask for help. And that's really a shame considering what a treatable condition it is.
And that's what we talk about. We got to get past the stigma, do we not? We got to realize help is available. Life can get better.
Absolutely. And depression can be treated by talking therapy. It can be treated by medication. It can be treated by living a healthier lifestyle, eating better, exercising more, especially sleep. All things that can really help prevent depression, and if you have it, also relieve it.
Thank you, Dr. Feinstein. Okay, these are the people you want to call right now. The information remains confidential, and I think you should make the call if you need to talk to someone. 303-698-0999. Again, the Depression Center with the University of Colorado School of Medicine. They really are the best, so give them a call if you need some help. We'll be right back.